Health for Life. This is the first ever medical show on television that deals with prevalent health problems and concerns, and they do so in an easy to listen to question and answer format. To find out what we're discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
I am Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program meant to inform you, the listening public, about common medical issues and concerns. Today, in the studio, joining me is Dr. Chris Prasad. Dr. Chris Prasad is a senior registrar in urology at the Georgetown Public Hospital Corporation, and Dr. Prasad also has privileges at many of the private hospitals in the city. Today, Dr. Chris Prasad is joining us in the studio, where we will be discussing a condition that is of great interest to us men, especially as we get older. And that condition is none other than benign prostatic hypertrophy, commonly referred to as BPH. Dr. Prasad, welcome to the program.
My pleasure.
Thanks for joining us. So let's get right into it. What is benign prostatic hypertrophy?
It's called a few things. It's called BPH, it's called an enlarged prostate, and in that second name it gives a hint as to what the process is. Okay. It's a condition that occurs when the prostate gland enlarges, and as a consequence of this enlargement, it may affect the way a person can pass urine.
So you mentioned it's a condition that is affecting the prostate gland. Tell us where the prostate gland is, or a little bit more about the prostate gland.
Sure, happy to. So first thing is you need to know is the prostate gland only exists in males. So okay. This BPH, as we're going to be referring to it a lot, the enlarged prostate, is a condition that can only happen or occur in men. It's part of the male reproductive system, and it lies very low in the pelvis. It's very close to the bladder, just in front of the rectum, and surrounds a tube that the urine passes out of called the urethra.
Okay. Now, what are those conditions that will cause the prostate to hypertrophy or to enlarge?
Right. No one knows exactly the mechanism of enlargement. What we do know is that it seems to be related to the male hormone testosterone and some of its derivatives. We also know that this enlargement usually occurs after the age of 50. As a consequence of the enlargement, the symptoms can be from mild symptoms all the way to severe symptoms, which can severely affect the person's quality of life.
Okay. Now, whenever we discuss a condition or an issue, we want to know, is this a rare thing? Is this a frequent thing? How common is benign prostatic hypertrophy?
It's incredibly common. In fact, most men over 50 will experience this and have some sort of complaints. As a matter of fact, men by the age of 60, about half of the men will have symptoms as it relates to benign prostatic hyperplasia. So it's quite common.
Okay. Now, we need for our audience, our viewers and listeners, to distinguish something about the prostate here. Is BPH dangerous, and is it cancerous?
Generally speaking, BPH is not life-threatening. Immediately, it has nothing to do with cancer, nothing to do with prostate cancer, nor is it a risk factor for prostate cancer. It can, however, based on its symptoms and the severity of the symptoms, really affect a person's quality of life and can be incredibly bothersome.
Okay. So it is not a cancer, but the symptoms of BPH and the symptoms of prostate cancer have a bit of an overlap.
They do.
Right? But it's not a cancer. Now, you say that the symptoms with time can become bothersome. So when does that enlarged prostate lead to bothersome symptoms?
Right. So like I mentioned earlier, the prostate is very intimately related to the bladder as well as the urethra, which is the tube that the urine comes out of the body through the penis. As a result of its enlargement, it starts to encroach upon these structures. Okay. And by doing so, what it does is it affects the way a person, the man, is able to pass urine.
Okay. So tell us, what are some of these symptoms that our viewers, especially the men, should be looking out for?
Right. So symptoms can be range from mild symptoms to severe symptoms, and they include things like, one of the first signs the man might notice is that his urinary stream is not as strong as it used to be. So there's a decrease in the stream. There might be hesitancy, which means that the man needs to wait quite a bit of time before the urine starts to flow when he's standing in front of the toilet. There can also be, on the flip side, frequency, that they need to go very frequently to the bathroom. And when they do go to the bathroom, they have a sense that they haven't quite emptied their bladder properly and need to return to the bathroom 10 minutes or so after. Along with that, they can experience some terminal dripping or dribbling at the end of the stream. And there's also urgency, where as soon as the man has the urge to pass urine, he needs to rush, and sometimes accidents can happen in that they can actually wet themselves in severe cases. These symptoms usually start after the age of 50, and they usually start slowly, and most of the time they worsen as the man gets older.
Okay. What about going to the bathroom at night?
That is also a symptom that is related to BPH.
Okay. So it's a little bit, if our viewers, if men are getting up frequently to go to the bathroom at night, that is of concern.
That is definitely of concern.
Okay. Now, what does the enlargement, the hypertrophy of the prostate gland, what are the complications can develop as a result of this?
A few things can happen if BPH goes untreated. A man can develop very severe symptoms, which of course can make him very miserable, and it can be very bothersome. Also, further to that, other complications would include urinary retention, commonly called stoppage of water, and issues with being unable to pass urine properly can lead to recurrent urinary tract infections. And sometimes in BPH you can even have issues of incontinence. Those are some of the major complications of BPH.
Okay. So we've got the patient at home, the men or their wives who are looking at them, and they're beginning to develop some of these symptoms, and they come into the clinic. How is the diagnosis of an enlarged prostate, or BPH here in this case, made?
Right, so a lot of the symptoms that I mentioned, and you even alluded to it earlier with prostate cancer, and some of our viewers may know from the symptoms I've mentioned, there are several other conditions that can cause these symptoms. So the first step is, if you're experiencing these symptoms, you need to see your doctor or your urologist. When they're sitting with you, the first thing that they will do is they will take a thorough history, and this involves asking you a lot of relevant questions. The basic idea behind asking these questions is to gauge the severity of your condition and to see how it affects you. After asking questions, the next step is usually an examination, and since the prostate is closely related to the rectum, that is the way that it is examined. The doctor will place a gloved, lubricated finger into the rectum just for a few seconds to assess the prostate. This is not usually painful. The doctor may also recommend certain tests, urine tests, a blood test, perhaps an ultrasound, and where available, flow tests. The idea behind this is to clinch the diagnosis, rule out other diagnoses, and to gauge the severity of your symptoms.
Now you're talking about severity here, so this is a grading system. You can have mild. How do you grade this severity? So
severity has to do with the symptoms that we mentioned. It has to do with how many of those symptoms the man has. It has to do with how frequently he experiences these symptoms, and also, and very importantly, how bothered he is with these symptoms. Okay. And based on the answers and responses to that, as an example, if someone is having many of those symptoms occurring very frequently and is significantly bothered by them, they will more than likely be towards a severe spectrum of symptoms and be affected by severe BPH.
Actually, I think there's a scoring system that is used, and that's what you're alluding to.
Yes. Right. There are two main scoring systems, but they generally ask the same questions. Right. The IPSS scoring system, which is the International Prostate Symptom Score, and the AUA. Right. They ask basically the same things as it relates to symptoms: the frequency, the flow, the hesitancy, the urgency, and they ask how frequently you experience these symptoms, as well as how bothered you are by them. You total up the numbers of the responses, and based on what number the patient falls in, you can loosely categorize them into mild, moderate or severely symptomatic.
And the higher the number, the more severe.
That's correct. The
is
higher the
disease.
number, the more severe.
So now you've got a patient, he's come in, he's got many of these symptoms, you've done your examination, and yes, for the men who are watching, it does involve placing, as you mentioned, a gloved finger in the anus in order to examine the prostate. A quick procedure, but it's one of the main hindrances to patients coming in to see the doctor. We need our viewers to realize it's important to get this done.
Absolutely.
So you've examined the patient and you've made a determination that the patient has benign prostatic hypertrophy. What's the next step?
We spent a lot of time discussing the symptoms and the severity of symptoms in the last few minutes. And the reason that's important is because treatment is usually based on the severity of the symptoms and how bothered the patient is. If the symptoms, for example, are mild symptoms, we can simply observe or employ something called watchful waiting, where no medication may even be necessary. We just give them some lifestyle advice, and they can go ahead, and if it gets worse, they come back and see the doctor. For moderate and more severe symptoms, then we get into the realm of needing medication and quite possibly surgery.
Okay. Now, so mild symptoms, watchful waiting. When it gets into the severe ones, you said you're starting medications.
Even moderate.
Or even some of the moderate.
Yes.
So how do these medications work? What are they going to achieve?
Right. There are a few classes of drugs you can use. There are two main classes of drugs used to treat BPH. One class of drugs acts on the smooth muscles of the bladder neck as well as the urethra to make passing urine easier for the man. So it relaxes that area, so there's less need to strain, and so that usually improves the flow. These medications are things like doxazocin, tamsulosin. A few brand names would be things like Hytrin, Cardura, Flomax. Okay. And the aim of those drugs are to help with mainly the flow of urine, and their effect usually occurs quite quickly in contrast to another drug I'll speak about, usually within 4 to 6 weeks, sometimes earlier. The other class of drugs, drugs called 5-alpha reductase inhibitors, and these are drugs like Proscar as an example. These drugs act on the prostate gland themselves and target certain hormones and hormone derivatives. The aim of that class of drugs is not so much to affect the smooth muscles in the area, but they actually target with the gland with the aim of reducing the size of the gland. It's almost never going to get back to the normal size, which is about 20 grams, but it is shown to decrease the gland by maybe 25%, whatever it is now.
Now, when you've decided to place the person on medications, you talked about two broad categories. Do we use them one after the other? Do we use them in combination? Is it based upon the severity?
Right. So you can be prescribed one drug, and sometimes if you meet the criteria, depending on your symptoms and especially the size of your prostate glands, you can be placed on combination therapy, which means more than one drug.
Okay. So the person is on this medication. When do they come back and see you, or how long are you going to wait to see some improvement in their symptoms?
Usually, after starting a patient on medication, their first visit occurs about 6 weeks after, where they have a symptom review. I should mention one of the things, though, is that a very frequent question I'm asked by my patients is, how long do I need to be on the medication? and the answer to that is, you need to be on it indefinitely. It varies from man to man. And that's what the follow-up visits are for. Initially, we see you more frequently because you may require dose adjustments. But as long as you become stable on medication, most men use medication for years. And they're encouraged to see their urologist at least twice a year, where their symptoms can be reviewed and their medication their doses can be either decreased or increased if necessary.